Good evening, friends, and welcome to this session on emotional freedom technique. We really appreciate your taking out time and joining the session today. The session today is being sponsored by Insure Sure. Insure Sure is an organization which is started by veterans from the insurance industry. It's about an year old, and they have done phenomenal work in the last 1 year, insuring assets worth over 10,000 crores. And we really appreciate their sponsoring the event today. I got introduced to emotional freedom technique a couple of months back when I was undergoing a course from Mr. Nitya Shanti. And this technique worked wonders with me. There are two personal experiences I would like to share with you on how I found this very particularly useful. One was when I landed up with a couple of consulting assignments all at one go, and I found myself being overwhelmed with the amount of work that was there for me to do. And I had learned EFT a couple of days back, so I just started tapping. And immediately I found that things cooled down, and I was able to handle all the assignments very, very well. That was my first experience with using EFT. The second and very dramatic personal experience. This in fact happened with my daughter, with my elder daughter. She is mortally scared of lizards, and our house has a couple of lizards, and we have done everything that we can do in our power to have a house which is free of lizards, including making modification to the house, doing pest control, and trying every technique that we can. But the lizards just won't go, and my daughter would be like shrieking and screaming, and it was anybody who's scared of lizards would understand what I'm talking about. And after I was learning and practicing this technique, then I said, "Beta, let me teach you this emotional freedom technique." And I did one round of tapping with her, and it is magical. It's been about 2 months. Our house is practically free of lizards, and my daughter is free of her fear. And she doesn't come running and screaming and shrieking about whenever because there are hardly any lizards there. So that is the kind of dealing with phobias is another place where I've personally tried and used this very, very effectively. And it was just one round of tapping that we did. So the benefits of these technique are very powerful, very tangible, and immediate. So that's the power of this technique. I don't want to overpromise. I would rather let you practice it and find out for yourself. But that's the benefit of EFT, and that's how I included it as a part of my daily practice, and I do it now daily. And conducting the session today is Dr. Nupur. Dr. Nupur is a medical doctor based in London, UK. She's a certified mindfulness teacher and certified clinical hypnotherapist. She has done a lot of work with cancer patients, and her work has been published, and she has won awards. Her work has won awards. And we are very happy to have you, Dr. Nupur, with us today. To conduct this session, and she has also learned this technique from Nitya Shanti, and she has done hours of tapping. So very, very experienced in doing this. Dr. Nupur, a couple of words from you.
Yeah, thank you, Ashish. Thank you for a lovely introduction. Am I loud enough? Can you just give me a thumbs up? Yeah, okay, wonderful. Thank you. Also like to say a huge welcome to everybody who's taken the time out and are present here. Thank you so much. And it's very exciting because this is a modality that Ashish and I absolutely love. And I got introduced to emotional freedom technique 6 years ago, actually. And I would like to start by thanking my teachers, Rohini, Sujata, and Nitya. I have learned it from them. I have used it in my coaching practice with lots of patients and clients, and it gives. It's amazing. I'm still sometimes amazed at how quickly it works. It's one of the quickest techniques, and it's a very powerful self-help tool that has been now also researched. It has been actually it has been around for not very long. It started, if I can get into the history of EFT, it was founded by Dr. Callahan, Dr. Roger Callahan, in 1980s. He was a counselor, therapist, a psychologist, and he had a patient who was coming to him for aquaphobia, fear of water. And this lady's name was Mary, and he had tried a lot of techniques with her. Nothing seemed to be working. And Dr. Callahan actually asked her, Dr. Callahan was also discussing, at the same time he was studying Chinese medicine. So he was studying acupressure, acupuncture. So Dr. Callahan just had a brainwave because he wasn't able to break through with Mary. Something made him ask her, where do you feel the fear? So when you are near water, where do you feel the fear? What happens? And Mary said that she has this knots and churning in her stomach. And that just got him to think that why don't I tap into the acupressure point for stomach, and then maybe we can see if it'll help her. And he started asking her to tap and touch the acupressure points for stomach. And that's when he started doing this with her, and all the knotting and all the churning in her stomach started to disappear. And as she started to report that symptoms were shifting, also he started shifting the points. So because we have different points in acupressure, acupuncture, you all know we have needles that we are inserting in different parts. So this lady was free of her fear of water, which they had failed to address through all other techniques. So it was so powerful. So Dr. Callahan started something which is called the thought field therapy. And it was quite intensive. It was quite elaborate. Then a person called Gary Craig, who was a Stanford engineer, he learned this technique from Dr. Callahan, and he decided to simplify it. And he then introduced it to the world as emotional freedom technique. And it's addressed more as a tapping technique. So that's how it is. It is being used. It is being used all over the world for various modalities, for pain management, for fear, phobias, for grief, for a lot of other things. And it's one of the most powerful techniques. And as Ashish said, how quickly it helped his daughter. And that's one of the beauties about this technique, that it actually helps children a lot. So it's one of those tools that once you learn this tool, it really can be taught to children or to other family members, and you can teach it to them also. It's not something that needs a facilitator to be there. So that's the power of this tool.
Thank you very much for sharing that, Dr. Nupur. So would it be right to describe this as an emotional acupuncture? Or emotional acupuncture?
Yes, yeah. Absolutely. It's actually called acupuncture without the needles. Mm-hmm. So emotional freedom technique is actually called acupuncture without the needles, because what we are doing here is we are activating different areas, and these are all endpoints of energy meridians. We have these energy meridians, we have these channels of energy in the body, and those are the endpoints of these energy meridians, and that's what we are tapping. So either we tap, but they are very powerful with touch, and they're also very powerful even with visualization. So sometimes we have had tremendous results when people are also saying that they were in a situation where they couldn't physically tap because they were, just in the middle of a chaotic situation, or they were in a place where they couldn't socially be tapping, but they imagined themselves tapping. And actually, as we go ahead and we discuss more about the course, we'll talk about certain scenarios where we recommend that you don't physically tap, but you imagine the tapping on these points, and it is still very powerful. Amazing results have come through that.
Awesome. Dr. Nupur, is this medically proven, or is it still in the experimental area? Is it an alternative therapy, or it's like getting mainstream?
So there has been research. There has been a lot of research, and there are a lot of studies. Also, it's being reported like consistently that cortisol levels are being in participants. Cortisol levels, cortisol is a stress hormone and it's a very easily measurable. It's something that we can measure in our saliva itself. So it's a very easily measurable biomarker of stress. And a lot of studies have shown that cortisol levels have come down. Also, because it's a fairly new, it started only in 1980s and 1990s, we don't have a plethora of research material. But it's something that is very amazing is that nobody is now waiting to get research material. Even though if you go and type EFT, you'll get lots of medical research studies showing that it activates parasympathetic nervous system, which is our rest and relaxation response. It is also something which is used extensively with PTSD, which is called post-traumatic stress disorders. Now, post-traumatic stress disorder is something that is very commonly seen in war veterans. It's very common in even COVID times, you know, healthcare staff has been exposed to so much stress in dealing with patients and managing in crisis. Plus also all of us, you know, post-traumatic stress could be, it doesn't necessarily have to be something as big as a war or a health crisis. It could be something like as a child when you perhaps got slapped by your parent, but you were in the middle and you took it very personally, and perhaps you were very embarrassed because you were slapped in front of your siblings or in public. For you, that could be trauma, and that can get lodged in our energy system, in our subconscious, and that triggers a lot of our adult responses. So tapping is also been very effective in PTSD. So we have a lot of minor studies that have come up, Ashish, but luckily nobody is waiting for a breakthrough to use it, because when we use this tool, you find it so powerful and so neutralizing. It immediately brings you into a calmer space, into a neutral space, that, you know, people are anyways using it. It's being used a lot by sports people, by athletes. It's being used by doctors. It is being used in clinical settings. So yes, there's lots of applications.
Yeah, that's very helpful, Dr. Nupur. You mentioned that, it helps people deal with their stress, with performance, like for athletes, trauma, phobia. Are these the only areas, or there is an, application in increasing the financial abundance in other areas also in life? Like, does it have only medical, clinical benefits, or does it work in all areas like relationships, love?
Absolutely. Yeah, it works. In fact, it works very, very powerfully in abundance manifestations. It is actually, we must understand that what is EFT doing? EFT is clearing the energetic blocks in our system. So it is a technique that is creating clearer energetic pathways, and it is releasing a lot of pent up baggage. So it helps in relationships beautifully. It helps in conflict resolution. Now, conflict resolution doesn't mean you're conflicted only with you could be conflicted with yourself, you could be conflicted with your spouse, you could be conflicted with your children, you could be conflicted with your colleagues, or you could have conflict with money, you could have conflict with the concept of something. So it is something that the moment we start to clear, it's a clearing our own blocks, energetic blocks. It starts to show results very quickly, and in fact in abundance. And towards the end of the webinar, we'll also be sharing a book which is known to help you with abundance. So EFT helping with abundance of whether it's wealth or health. It can really, really create shifts. The only thing that is needed from our side is, I would say, commitment to practice, because that's what is people swear by doing EFT practices. In fact, we have so many testimonials that come up. Children with bedwetting. In my own practice, children with bedwetting, children with an inability to sleep at night when they wake up with fear. You mentioned phobia. So this is something, once you learn this technique, the only thing you need to do is be open-minded and practice it. And the more you practice it, the more results start to show up.
Dr. Nupur, you made a very valid point about being consistent in the practice with of EFT. But we are so, everybody is overwhelmed with the amount of time we have. The number of things we have to do in the limited time that we have. So, is it a practice which takes a lot of time? Do I need to keep aside like 30 minutes, 1 hour, 2 hours every day, or is it something can be done in a short period of time?
Absolutely. It's something that we can definitely do in a very short period of time. In fact, we will be doing one round today, and let's see, just a few rounds, you will start to feel a shift in your own emotional space. Also, what happens with EFT, Ashish, is a very interesting thing. It's like almost opening the layers of an onion. What happens is you start to unravel. Suppose you have an issue with public speaking. Suppose somebody has an issue with public speaking. Now, if somebody says that, when I am going on the stage or when I'm addressing a huge audience, I start to shiver, my knees start to shake, my mouth gets dry, my heart starts to beat. So what's happening here? There is a phobia, a fear of public speaking, but the manifestations of that are happening in the body. The mouth gets dry, the heart starts to beat, the palms get sweaty, the knees get trembly. So what we do in EFT is we not only tap on the fear of public speaking, but we tap on the physical issue, the dryness of the mouth, the palpitations. So we target these areas. Now, what happens is as we start to tap, so a lot of times physical issues are addressed emotionally and emotional issues are addressed physically. So we do both. Now, what happens is as we start tapping, we start realizing that we are almost uncovering the layers of the problem. We go back to the roots of the problem, and we actually go back to the point that where did this problem actually start from? And we EFT starts to unravel the layers to the point that you can actually come to the root of the problem and release it from the time of inception, because most of the things have a trigger. So it starts to release a problem from its roots. And that's why we say to stay with it, because all of a sudden you'll say, oh, I suppose you are doing EFT for a relationship conflict. And you start by saying that I cannot stand my boss. I hate her, but I have to face her every day. What do I do? So you start tapping for that. And you'll very soon start to realize that the hatred starts to shift into irritability. Irritability will start to shift into annoyance. So you start to notice that not only the level will come down, but then somehow that will start to release into, and your subconscious mind starts to throw back. You'll remember a teacher perhaps, or somebody as a child who was very wild with you, or perhaps shamed you in front of a lot of children. And that's what triggered your response to anybody in authority who is a particular figure. So I've had people who can go back, who have gone back to the trigger point. So that's why we say that, yes, it can take you 10 minutes, but there have been times when people have practiced it for even 30 minutes, 40 minutes and seen the shifts, because it goes back to the root cause and it releases from the root. And it's a very interesting thing that I would also like to share, Ashish, here with our audience, is that sometimes, a lot of times when we are doing EFT, a lot of things get released. So people start remembering incidences even in their sleep. People start to remember things of incidents which are related with the problem, and they even start to dream that. Because why does that happen? Because our subconscious mind is trying to tell us that this is what you have stored and held on to for so long, and that is contributing to your issue.
That's awesome, Dr. Nupur. What I hear you say is that even practicing 10 minutes a day can help us get to the root cause of the issue, and anything that gets treated at the root cause, the benefits are long lasting. What
Absolutely.
I would like to understand is it a safe practice? You mentioned about things coming up. So is it also possible that somebody gets an undesirable effect of practicing, or is it safe to practice?
No, it's, see, the thing is, that's why we call it's a cleansing technique. It's an energetically cleansing technique. And whenever you are doing, and I'm sure many of us on this call must have done some kind of a physical detox, and when you're doing a physical detox, sometimes your body will release things, and you may have breakouts, you may have some, loose motions, or you may have some ways of releasing. But that is something which is better out than in. So even if you are releasing something, it's good. Sometimes also it happens that, we have stored it in our energy system so long that we don't even know how much it is detrimental to us, and it's causing. And in fact, I would go to the extent of saying that mostly all health issues, 99% of the health issues have got emotional component. So it's so important to release all these pent-up emotions, pent-up energies, subconscious patterns from our energy system. And when we are releasing them, you may have some transient discomfort, but that is not something that will happen to everybody and in great intensity. But it's better out than in.
Thank you. Thanks for sharing that. I'm sure that will put many people at ease. We have a comment from Farzeen. She says it's a very effective practice. Farzeen, is there something you would like to share with us? Would you like to unmute and share any experience you've had with tapping or with EFT earlier? Anyone would like to share? We can take. Yeah, Farzeen, please.
Yeah, Ashish, basically in 2019, I lost my husband, and post that, I mean, I used to feel that there is this heavy load on my chest, and I wasn't able to, get rid of it, despite all my all the spiritual practices and everything. And then one life coach took me through this. It was a 1.5 hour session, and I didn't even realize how long it lasted. But yeah, she made me do this meditation with the tapping. And after that, all that was, I mean, that feeling of that, load on my chest was gone. So yeah, I have experienced it, and it is very, very effective. Yeah.
Thank you so much.
Thank you, Farzeen. Thank you for sharing that. And all power to you, because, you took that step. And, that's something I always encourage everybody who comes in my orbit, that, our life is meant for us to live with joy. We all face challenges. We all lose loved ones. We all get diagnosed with all kind of issues. But, that doesn't mean that we need to stop living. As long as we are alive, we owe it to us that we live to the best of our abilities, joyfully, as happily as possible. And this technique is such a powerful self-help tool that once you learn it, you can use it for anything, absolutely anything and everything. And you can teach it to people at home, like how Ashish mentioned, he taught it to his daughter. And children love it. In fact, children love it because it's a technique that involves using your fingers, your hands. They find it fun, so that's something that can be used, and with something as intense as Farzeen mentioned just now.
Thanks, Dr. Nupur. We have one more question from Ranjita. I would just like to check with you if you would like to open up the session, or should we do a round of tapping and then go take more questions?
I would probably suggest that let's do some tapping together. We all can do some tapping together. Let's experience it, and then we can do it. Yes, and then we'll take up the questions. You can let your questions keep them coming so that you don't forget it. So you can feel free to type them or keep them in your mind or write them down. And then let's address them all at the end.
Sure. Ranjita, Ramesh, thanks for your questions. We will take them up once we do a round of tapping. And one thing, Dr. Nupur, I just want to clarify with you before we start tapping. If I tap harder, are the results better, or it's like gentle tapping? Do I need to beat myself up?
No. You don't have to hammer anything out of your system. You don't have to go hammering your body. In fact, that's a very beautiful question you ask. Some people think the harder they tap, the bigger the things are going to come out of them, and there's going to be a huger detox. Nothing like that happens. Gentle tapping, don't hurt yourself. Something like, just gentle pressure. Okay. That's enough. And as we will be discussing the points with you, I'll be guiding you through the points also. And we will tap around, very gentle tapping where you can just feel that you are, gently knocking the body, very gently, very lovingly. See, we have to understand that at the bottom of everything, it's love. That's the healing energy. What heals is love. So do it with a lot of love and reverence. And that's enough. No hard hitting, please. Everybody, very gentle tapping.
So over to you, Dr. Nupur, to lead us in this. And yes. I will request everybody to keep your cameras on if you're comfortable, because if we can see you, then we can possibly guide you better.
Absolutely. Ashish, can I just request you to put up the slide on the EFT points?
Yeah, sure.
And while you do that, I will open up the floor to the audience. Is there anybody who would like to volunteer to do the tapping, who would like to do tapping with me today? Anybody who would like us, we can pick up something not very intense, but something which perhaps it could be a physical discomfort, pain, something which is not deeply chronic, something, which is anything, which you think would like to tap with me. We can do a few rounds and see how you feel about it. Until somebody gathers up the thing to come up, let me discuss the points. So these are the typical points on the face and the body, which are key areas of tapping for emotional freedom technique. So I will first just tell you the points. At the top of the head, we have 1 point. Then here, eyebrow point, where the eyebrows end. So approximately this area. Yeah. So we always tap with 2 fingers, most of the times on the face, and on the body, we can tap with all the fingers. We can tap like this. So 2 fingers on the face. Now, some people prefer to tap only one side. When I teach, I usually prefer to teach on both the sides. So you can tap on both sides. It's up to you. Then the next point is the side of the eyes. So it's the point on the side of your eye where the bone is, just here, the corner of the eye where the bone is. So we are tapping on the bone on the side of the eye here. Yeah. Then we tap on the bone below the eye, right? Don't go into your eyes, please. Be very careful. Don't hurt yourselves. It's the bone here, just below the eye. If you look straight, so you tap here. Yeah. Then the next point is under the nose and above the upper lip here. Yeah, under the nose. Then the next point is below your lower lip and below the lowest point of your chin. So it's like somewhere here at this kind of elevation. Then the next point is on the collarbone, just a few inches below the collarbone. So if this is your collarbone, you can feel your collarbone just below it. Just below that notch or where your collarbone ends, just come down here and you can tap both hands, all fingers. Yeah. So that is called the collarbone point. Then the next point is under the arms. It's almost 4 inches below your armpit. And it's here. It's almost where the bra strap for women is, or where the vest comes for the men. That's called it's also called the monkey point, because sometimes people do it with both hands and they look like a monkey. So it's also called the monkey point. So that's where it is, right? And then we have, so this is what we do in cycles, right? So these are approximately the points. And the first point that we start with is the karate chop point. Yeah, so this is called the karate chop. This is the point where we have, when you are doing karate, this is where you use. So you can, with karate chop point, you can use all 4 fingers, or you can even use both hands, whatever you feel comfortable. I prefer to do 4 fingers on the karate chop point. So when we start usually by saying a statement, which is called the setup statement. And we say the setup statement 3 times, starting at the karate chop point. Yeah, and I'm going to demonstrate how we're going to do that. Once you have said the setup statement 3 times, we then tap on the various points. And that is called the reminder phase, which is we are doing on the various points, and we will demonstrate so it will become clearer to you. And that is just the crux of the problem. So suppose somebody says, I have a pain in my knee. Suppose they say I have pain in my knee. Now the setup statement is, even though I have this pain in my left knee, I deeply and completely accept myself. And that's how we are going to say this. This is called the setup statement. We say the setup statement 3 times. Even though I have pain in my left knee, I deeply and completely accept myself, or I love and accept myself. Even though I have pain in my left knee, I deeply and completely love and accept myself. And then we start saying, tapping on the point, starting with eyebrow, this pain in my left knee, this feeling of discomfort, this pain. And that's how we are going to continue. So once we have a volunteer,
so
then we are going
Sarabjeet, who has volunteered.
Nupur, I volunteered. Sarab, is that okay
Hi,
with you?
Sarab. Hi, Sarab. Lovely to have you here.
So lovely.
Thank you for joining. Such a pleasure. Perfect. So let's do it with Sarab. Thank you, Sarab. So let's, if the points are clear, should we keep the slide, Ashish, or should we remove this? Okay, perfect. So Sarab, would you like to please share with us how can we do the EFT today? What is troubling you?
I injured my knee 6 months back, but
Okay.
last week only I realized although I have not rested, but there is still fracture. Doing so many healing sessions with all of you guys, but there are 2 fractures still on my right knee, and there's a rod joint also with a screw there already, so it is affecting.
So what are you experiencing
And on my
right
ankle,
now?
it's a little pain when I put my knee on, even on a bed or a soft surface. It's pain. Otherwise, I don't feel nothing. And
So
on my
pain.
ankle, that portion, because of the rods in my leg,
Okay.
I feel pain there also around my
So-
ankle and the
so-
base of the feet.
Okay, so you have a physical rod placed in the leg.
I had a very terrible accident. If it goes back 11 years back, I have my tibia, fibula, femur all broken, with a broken
Okay.
hip bone, iliac
Okay.
bone also. And I
Okay.
am living with it.
Okay.
And I do everything now. You're aware.
Yes. So shall we take the pain in one side today for the ease of demonstration, if that's okay with you? Should we take pain on knee or pain on ankle, whatever you prefer?
I think better on the ankle and base of the feet. That area.
So
that
let's
portion.
take pain in the ankle then. Yeah. And the base of the feet. Base of the foot. Now, is it on both feet or one foot?
Only the right one.
Right foot. Okay.
Yeah.
And tell me, is this constant pain, or is it something that comes and goes, or when does it get more? When does it become? Just give me a bit
My
of
activities levels are too high when I'm doing a lot of walking and biking.
Okay. And right now, as you're seated, is it still paining?
Yeah.
Okay. So on a scale of 0 to 10, now everybody be just mindful that this is what we should always do. As I'm discussing this with Sarab, it'll be amazing if you can pick up some issue that you would want to tap with. It could be pain, it could be any other issue, it could be disturbance, irritation with somebody, or it could be a sense of feeling low. Pick up your own issue, but you can tap, as I will be guiding Sarabjit, but you can also tap in your own spaces, and you can just say the same statements which I am saying with Sarab in your own spaces. And this is called borrowing benefits. This is again a very powerful thing. Okay. On a scale of 0 to 10, which is called the SUDS scale, subjective units of distress. Please number your issue from 0 to 10, 10 being excruciating, extreme, 0 being no problem at all, absolutely no problem. So Sarab, between 0 to 10, where would you be on the right foot, ankle and base?
I would say a 10. It's a lot of pain. I just was riding somewhere and I just came back. So just because Ashmita reminded me, I actually forgot it's at 4, so I canceled and I drove back fast. So maybe.
Okay, you were on the bike, so you've come back.
Yeah.
Okay. Yeah. And you said this accident happened 11 years ago?
Yeah. 31/12/2010.
Okay. Yeah. So right now, so we always, when we are doing the SUDS, always we number the intensity in this moment, not what it was 2 hours ago, not what it was yesterday. It's always about right now. So for Sarab, it is 10 on 10. Okay. Now let us do a few rounds of tapping and see if we can shift the, if there can be a shift in the intensity, right? Also be very mindful that it's a bit of a chronic issue with Sarab. So, right, so it's been there for a long time. It's because of a physical rod, because he had an accident and surgery there. So when somebody presents with something which is more chronic, we must understand that it does take a bit longer, and that means a little bit of consistency of practice, right? But Sarab is a healer himself, so I know he'll do it with full openness and gratitude. So let's begin.
Honestly, that's the reason I could, because the doctors ruled me out that I would never be able to even walk again. With the kind of 63 broken bones and what I told you, the kind of things, 117 fractures, they just ruled it out. And I was walking 88th day. So maybe the willpower or whatever God gifted.
Yes. Okay. Thank you. And it's good to know as much as we can, because this is what we are going to be including in our tapping. So Sarab, let's start it. Yeah. So we start with karate chop point, and we start by tapping, even though, and everybody please do it in your spaces, even though I have this pain in my right foot, in the ankle and the base of my foot.
Even though I have this pain in the base of my right foot and my ankle,
I deeply and completely love and accept myself.
I deeply love and accept myself.
Even though, we say it 3 times, even though I have this intense discomfort in my right ankle and foot.
Even though I have this intense discomfort in my right ankle and my foot, base of the foot,
I deeply and completely love and accept myself.
I deeply and completely accept myself. Even though I have this intense discomfort in my right base of the foot and ankle, I deeply love and accept myself.
Yes. And now we start tapping from the top of my eyebrows. Sarab, you might need to take off your glasses at some point. So here we say the reminder phase, this intense discomfort.
This intense discomfort.
This feeling of pain, side of the eyes.
This feeling of pain.
This feeling of deep discomfort in my right ankle and base of my foot.
This feeling of deep discomfort in right base of the foot and my ankle.
Below the nose, this deep feeling of discomfort.
This deep feeling of discomfort.
Chin, this pain.
This pain.
And tap in and tune into yourself, Sarab. Just feel this
Yes,
deep.
my eyes are closed.
Yeah, keep your eyes closed. I'll keep saying the points. Now come to your collarbone point. You can open your eyes every now and then to see where I'm tapping. This deep discomfort.
This deep discomfort.
This intense pain below your armpit, one side or both. This deep discomfort.
This deep discomfort.
Top of your head. Top of your head here we tap. Yeah. This feeling of
unease.
All this pain in my right foot.
All this pain in my
eyebrow
right
point.
foot.
Come to the eyebrow point. All this pain that I have been living with for the last 10 years, 11 years.
All this pain I've been living for the last 11 years.
Even though the doctor said, I will not be able to walk again.
I will never be able to walk again.
All this discomfort.
All this discomfort.
All this feeling of pain.
All this feeling of pain.
All the emotions that are associated with this discomfort.
All the emotions that have been associated with this discomfort.
All the emotional baggage that has been contributing to this pain in my right ankle.
All the emotional baggage that has been contributing in my right ankle.
All the sense of frustration.
All the sense of frustration.
All the sense of why is it still paining?
All the sense of why is it still paining?
It's time to release it all now.
It is time to release it all now.
I choose to release it all now.
I choose to release it all now.
I am open.
I am open.
To full and complete healing.
I am open to full and complete healing.
I am open to divine healing.
I am open to divine healing.
I am open to miraculous healing.
I am open to miraculous healing.
And I trust it to be so.
And I trust it to be so, and Dr. Nupur as well.
And I trust my body.
And I trust my body.
And I trust my body for this magical, miraculous healing that is already happening.
I trust my body for this magical, miraculous healing that is already happening.
And I'm grateful for it.
And I'm very grateful for it.
And I know that my body has its own divine intelligence.
And I know that my body has its own divine intelligence.
That's taking care of this hurt and pain.
It's taking care of this hurt and pain.
All parts of me are ready to release it.
All parts of me are ready to release it.
Now.
Now.
Top of the head, and so it is, so it is,
And so it is, so it is, so it is, so it is.
Just put your hand down and take 3 deep breaths. Take 1 deep breath and release with your mouth. Take the second deep breath, deeper than the first. And release. And a third deep breath. Take a deep in breath, hold for a few seconds. Hold, 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 and release. And now just, Sarab, just notice the discomfort and tell me on a scale of 0 to 10, has there been any shift? Just move your ankle.
As
see
you
how
were
it is.
making me do it, there was some shift of energy. So I would say at a 7 or 8 as of now. But I could feel there's some shift of energy. But on the contrary, I remembered that I have pain in my left shoulder also because of a fall about 6-7 years back in Vedanta, West Germany.
So classic, Sarab. That's so classic. Thank you for sharing that. I'll come to that also. So 7 and 8. Let's take it as 8. Okay. So for
I would say
just
7.
You would say 7. Okay. So in 3 rounds of tapping, we felt a pain sensation that has come from 10 to 7. Yeah. And
very honestly, yes.
Yes. And this is something which is so classic that the moment we are dealing with one part of the body, Sarab automatically remembered that there was another part of the body also that was impacted by that. But because the intensity of the pain in the ankle was so strong that the intensity of the pain perhaps in the shoulder or some other part of the body got a little pushed down. Yeah. But the moment we start addressing it, so, we have to understand that our body is a field of intelligence. Our body is not organs put together. It's a very, very powerful, intelligent field. And that starts to speak to us. So the moment we start tapping, our body starts to speak to us that, oh, please address me also. And the moment this pain will slowly come down, the other pain, it's not that tapping caused that pain was already there. And that pain now started to surface. Why? Because pain is body's way of telling us, look at me, take care of me, and that's the way. Pain is the language of body to tell us that don't ignore, don't neglect, don't abuse me, take care of me. So now Sarab's shoulder and arm is telling him to address that part. So, that's why I was saying that these are layers of onion. When we start peeling these layers of onion, different things will come. Now, if Sarab was with me for a 1-to-1 session, we would continue tapping till his score comes down almost to 3 or less. Our intention in sessions is to bring it down to 0, not 1. We never say 1 to 10. We say 0 to 10. 0 to 10 means if the intensity is very high, we bring it down to 0. And we do multiple rounds and we keep, so right now, because of constraint of time, we couldn't go into other depths of other things, because everything that is, we also go back to the time of trauma, because when Sarab had this accident at the time of, his body has logged that also as a traumatic incident. So we also need to release that. The things that the doctor told him also are somewhere registered in his subconscious, though he has defeated it beautifully, but somewhere it's still logged in the subconscious. So, we start working in many layers and a lot of things get released for his healing. Sarab, I'm very grateful to you. Thank you for coming and volunteering today.
Thank you so much. Thanks so much.
Thank you.
Thank you for that, Dr. Nupur. And thank you, Sarabjit, for volunteering.
Boss, thank you, boss.
Thank you, Sarabjit.
I still call you boss only. Please pardon me for that. I can see Deepan smiling also. Hi, Deepan. Sarabjit Takkar. If you will remember my name, Takkar. Axe New York Life.
Of course. How are you?
Good. Thank you. So, Dr. Nupur, we have got a couple of questions. Would you like to, could we take them up?
Yeah, absolutely, Ashish, definitely. I just also want to ask anybody who was tapping on their own while I and Sarab were tapping, anybody has to report anything? Did they feel any shift? Did they experience anything?
Dr. Nupur, Ashmita here.
Hi, Ashmita.
Hi. Now, this is something which has happened very beautifully. I had a pain on my right arm since last 15 days, especially in underarms and in my full hands used to pain on and off, So in last 15 minutes when I was doing, out of scale from 10, it has come down to 6, and which is amazing. And I shared the same with my mother also, who's sitting next to me right now. I said, my pain is suddenly gone. And she was wondering what I am doing with this tapping right now. And when I shared with her, she said, even I have to do something for my knees. Thank you. Thank you.
Thank you. Thank you, Ashmita, for sharing that. In fact, a lot of times, one thing that people, skeptics and critics say, and I invite anybody who's a skeptic and a critic, please come up and ask questions. A lot of times people say that this is a distraction technique. Because you are tapping on the body, you are actually distracting yourself from the issue. On the contrary, I would like to share that it's actually facing the issue head on, because we are tapping into the pain. Suppose somebody would come up and tell me that I have a fear. I have a fear that I'm living with. In other modalities, we tend to overlook the fear, but in tapping, we tell you to bring up the fear. So if you tell me you have a fear of heights, I'm also a subconscious reprogrammer. So I will guide you into a scenario where you are at the top of a place and you're shivering, because what we do, we bring it up so that we feel it fully and then we tap with it. So on the contrary, EFT is not about a distraction technique, but it actually brings up the fear to resolve it, and that's how we do it.
Thank you. Thank you, doctor.
Thank you, Ashmita. Yes, Ashish, please go ahead with the questions.
So the question is from Ranjita. She's a counselor. She asks, is this technique that we can use in a counseling setting with clients?
Absolutely. It's used by counselors, coaches, and therapists all the time. And the only thing I would say is, before you use it on anybody else, you should have a very, very thorough and a powerful learning of it. So it's worth learning it, experiencing it, using it on yourself, and being fully confident, because there are many aspects of this also, and I've been doing it for 7 years now. So, it takes some time. I'm not saying it will take you 7 years, but it will take you at least 6 months to a year to learn and master. Learning is very quick, but, practicing it and to be on the, because you're offering it to somebody else, I always say, be very thorough. I think that's my medical training that kicks in, always says that before you offer it to anybody else, please be very thorough with it. Yes, so that's the answer.
Ranjita, hope that was useful. Else we are happy to take a follow-on question. There is a question from Ramesh, Dr. Nupur. Are there levels in learning?
Ramesh, the protocol is very simple. Having said that, there are certain more nuances to this protocol, which I will be teaching. So we are actually launching a course from Thursday, which is going to be a 2-session course. Ashish will talk about it. And we are going to be teaching nuances of this technique, which I just did, which has some more facets to it. But once you learn, the technique is very basic. Now the levels come in your ability to integrate it. What happens is that the more you start doing it, the more you start understanding that how can I approach an issue? How can I approach? So there are no level 1, level 2, level 3. All the levels that will happen will be in your own understanding of it. So that's why we are doing it over 2 Thursdays, over 2 sessions, this workshop, where you will understand a lot of facets of this issue, of this tapping modality. And you will also learn some other aspects of it. And there are many, I told you I've been learning it for 7 years, not because it took me 7 years to learn it, because it keeps coming up with new techniques. So recently I did it a very intense learning session with Nitya Shanti, which was for 21 days. And we learned so many more techniques to it. So once you've learned it, there is only one level, but you can get better and better at it with practice.
Thanks, Dr. Nupur, for that. There's a very good question from Elizabeth. Is there a fixed order in which we need to tap the points?
Initially, Elizabeth, like we all learn A, B, C, D, E till Z, we learn in a pattern, right? So that once we can form the words, it helps us. But once you've mastered the technique, you can just pick up any point, and these are the nuances also which we'll be going over in the course. You can pick up any point. Sometimes, what you feel that you're in a public space, you can't tap. You can even tap one finger. There are finger points which we will talk about later on. You can just tap, even like, you can just put your hand here and tap. You can just pick up one area which you tap. And also we must remember that these points are endpoints of energy meridians. So there are multiple energy meridians that correspond to different area. Like this is a chin is central meridian. Eyebrow point is bladder meridian. So, sometimes when you have specific issues, you can also pick up those points for those issues, for those organs, and tap them. So one point is also enough.
Thanks. There is a very good question from Deepan. Does this work for physical conditions only, or for example, can this work for financial abundance?
Absolutely. It works for abundance. It works for abundance in all aspects of life, financial, emotional, personal. It works for, generally the feeling of abundance, because when you start clearing your own energy, you start clearing your own blocks, you start getting into a higher vibrational space. And once you are starting to operate from a higher vibrational space, you then start to attract more opportunities. You start to see that life starts to open up, because everything is actually an echo of our own energy. The moment we start cleansing our own energy, whether it is for an emotional issue, physical issue, mental issue, the more we start to seeing that there's a reorganization of the energetic field around us. And that's abundance of finance is something that we have seen. You can even Google it. There is a wealth of information about abundance and EFT.
Dr. Nupur, there are a couple of questions more, but I'm conscious of the time. While we will take all the questions, I just wanted to check with you. Would you like to share about the course that we are coming up with? And then,
yes, please.
Because there might be some people who might need to leave at 5, because, and then maybe we can continue with the
Yeah, absolutely. We'll stay back and address all the questions. So people who have asked the questions, please stay back. So as I said, that the program is being organized over 2 sessions. Now, there are certain areas which we can go into depths of. And what Ashish and I discussed was certain key areas where we feel that, by going deeper, we can really give justice. We can go into the technique deeper. We can address these areas. So certain areas which we'll be covering over, and this is not a fixed list. If time permits, we can even do more. We can pick up more topics also over those 2 days. Physical issues, fear, stress and anxiety, conflict resolution. Now, conflict resolution is something which is all of them are very powerful, but in conflict resolution, what I have done is I have combined EFT tapping with forgiveness. And that's where we'll be talking about the power of Ho'oponopono prayer. It's one of the ancient Hawaiian traditions. It's a webinar in its own self. I conduct sessions on forgiveness and Ho'oponopono, but we are going to combine them because they are so powerful. Because for any conflict that you have, whether it's a conflict with your neighbor, or whether it's conflict with yourself, we have to understand that the only way to resolve a conflict is by resolving our own perception of the conflict. because there are two people involved in a conflict. I think somebody has unmuted themselves. So if you don't mind.
Can you please mute yourself in case? Yes, Goel sir, we will come to you. We have made a note of your request.
And Mr. Satish, if you could please mute yourself. Thank you. So that is one area which we are going to be focusing a lot on, and abundance. Now, abundance tapping, again, is what Ashish was mentioning. Somebody questioned also, is an area which we are going to be addressing. And also we'll be doing a lot of things about surrogate tapping. What is surrogate tapping? Now, surrogate tapping is that you can tap for somebody else. If somebody in your family is going through a crisis, you can tap for them. They don't have to tap. You can tap on somebody else's body also. Then borrowing benefits, imaginary tapping. And then also when we have a group, we can, besides the webinar timings, we can make each other your tapping buddy, and you can practice tapping and you can be there for each other and tap together in times. We'll make tapping buddies in the webinar, and you continue doing that. These are very powerful things that we have come up with for you guys for those 2 days.
This definitely sounds like a very powerful program, Dr. Nupur. What I would like to share with everybody is that these sessions will be conducted over 2 Thursdays on 9th and 16th of September. And we have kept it at a time, when you are free with your office work, and you can join at 7 p.m., 1.5 hours each on 2 days. And there is a very nominal fees. If you register today, you pay just 2,000 rupees. There is a special price. And if you register tomorrow till 9th, then it is 2,500 rupees. And you can remit by Google Pay or Paytm. And you can make a note of this number, take a screenshot or write it down, and you can do. Once you have made the transfer, please share screenshot with me. I'll be sharing my numbers, with you towards the end of the webinar. So, Dr. Nupur, anything else you would like to share about the program?
Yeah, Ashish, I will just say that, you have done the tapping today. You've understood the points. You've understood the technique to some extent. Also, know that when we are doing this in the workshop, I have, in my experience, so every EFT teacher develops their own style and technique. So I usually have designed it in such a way that we work with the issue. Then I have developed it in phases. Then we work with the resistance to the issue. A lot of times we don't realize that there is a part of us that is resisting solution. There is a comfort in pain. There is a comfort in suffering. So there is a part of it that resists change because we don't know the unknown, what will be life without this. So we tackle the resistances also. Then we tackle the healing, and then we tackle the gratitude for the healing. And we tap as if it has already happened. So there are a lot of finer nuances that I have personally developed. Thanks to my wonderful teachers, as I said, Sujata, Rohini, and Nitya. They have really, and to all my clients and patients who have also helped me develop this practice. So this is what we are going to be dealing with in phases. And these are the techniques which I will teach you, and then you can take it ahead to your family members also.
So what I hear you say is that you have put your 7 years of learning from different teachers into this 2 days of 2 sessions of 1.5 hours each.
Absolutely, and I'll give my 200%. So it'll be lovely to have a group together, because we also learn from each other a lot. So it'll be wonderful.
Thanks, Dr. Nupur. And friends, let me tell you, coming from Dr. Nupur, who is a medical doctor, certified mindfulness teacher, clinical hypnotherapist, this is a very, very powerful program. So don't, if you have any questions, we'll be happy to take regarding the program or otherwise also. So please stay till the end, because we are also going to share some more resources with you. Thank you, Neena ma'am. Neena ma'am has confirmed that she is the first person to come on board this program. So thank you, Neena ma'am, for confirming, and we look forward to having you.
Nupur, what's the time?
7 to
7
8:30 p.m.
7 p.m. to 8:30 p.m. Sarah.
IST, India time.
7
And
to 7:30
we will
I have my
go
session.
back to the questions.
I think if you can attend, Ashish, will we be recording those sessions also for people
Yes,
who
yes,
can?
yes. We'll be
So
recording.
suppose you can attend one Thursday and you can't attend the other Thursday, we can give you the recordings also. So that will be available as well.
There is a question from Sebashish. For how long we should do it as a normal healing process?
You should do it at least for, depending on the situation, depending on the issue. That's when if it's a chronic health issue, I would say 21 days to continue doing it. If it is something you will know yourself, your body will tell you, your life will tell you, but I would say its consistency is the key, and every day doing it is important. And I read some question also, how many times do we have to tap on each point? I would say 5 to 7 times to tap on each point, and this is a technique which you can do for 10 minutes, 20 minutes. I have done it for 20 minutes. I've done it for 30 minutes also. I've done it for 30 minutes in the morning, 30 minutes at night also. So, once you learn this technique and once you commit to doing it, you'll know. But first, depending on the situation, I recommend usually chronic issues longer.
Thank you so much.
So this was a question from Nina ma'am, which I think you've answered. Can we do it for another person who is sick, may not be able to do it herself?
That's called surrogate tapping, and we'll be discussing this in the program.
I guess we have got all the questions.
I think Mr. Goyal.
Yeah, Mr. Goyal, please. You're on mute.
Yeah. I have a problem in joint pains and cervical, back, middle back, and a right joint. I limp on the right joint for quite some time, and cervical problem is quite old, but it has increased. But my major problem right now is I am a slightly, anxious person, insomnia. And while going to sleep, especially, what happens, things move around the figures and all those kind of things. So just, my mind is wandering around thinking one thing or other, or just, normal, nothing anxious, but it keeps me awake. And then I start getting, especially upper body, something like palpitation type, feeling from different places. I start getting them. Then I have to take some medicine to sleep. Even Alprex 0.5 or 0.25 even might do, but something I have to take. So I do not know how to resolve, especially this is the worst case for me right now, more than the joints pain and cervical pain. But that is quite severe otherwise. But this is what I want to resolve right now.
Yeah, so you can definitely see if you can come up for the workshop, and you'll learn tools and techniques to handle that. Basically, how can you allow yourself to sleep better? And so we have picked up other topics, but we will try our best to see. Once you learn the technique, Mr. Goyal, you can use it, whether it is for your cervical, whether it is for your hip, whether it is for insomnia. You can use these techniques, So in EFT, we don't have prescribed EFT for different techniques. What we do is we master the technique, we learn it, and you will have two Thursdays to understand what it is. We might be doing it for pain, we might be doing it for conflict, but the crux will be the same. And then you can adapt it, which we will obviously guide you to your situation, whatever your situation is.
And for sleep, what time it is to be done?
So for sleep, you can do it during evening time, during night time, and even you can do it while lying down without touching it. You can just imagine you are tapping on the points and you can do it. So that's why I said that there are certain times when you don't tap, you imagine that you are tapping and you do it.
Otherwise, say 1 hour before sleeping and all that kind of things.
You can try. See, that's what I'm saying. It is not prescriptive. You can see what works for you.
Okay.
So once you learn the technique and you learn the thing, you can adapt it to your situation.
Okay. Thank you.
Deepan sir, just 1 minute, one short announcement. So friends, we are pasting the link to the feedback form in our chat. So please take a minute to fill out the feedback form. I understand this is time for some people may want to leave. We are 5 minutes over. So it takes less than a minute. Please fill out the feedback form. Your feedback form is very important for us. And then, we will resume taking your questions and we'll resume our discussion. And once you have filled out the feedback form, please type FD, feedback done, in the chat.
Yeah, Mr. I think Dipin was asking about finance being a chronic issue.
Yeah.
Well, yes, if it's something that you've been troubled by for a long time, then yes, it is a chronic issue.
So tap longer.
Not necessarily tap longer, but also understanding various aspects of it. Technique, getting into the issue, understanding the blocks, and then releasing it. Yes, and obviously being consistent with tapping. Doing it for 10-15 minutes every day, longer if it's needed. Doing it twice in a day, doing it for longer time, and then start to see how shifts are. Because even finance is different for different people. It's a different forms, different ways of manifesting. What you may consider a financial trouble may not be a financial trouble for somebody else. So there are many aspects of which you will have to figure out. And once, of course, we'll be there to help you and guide you in that.
Thank you. Thank you.
Nupur, this is Ranjita here. Is it a good time to ask a question?
Yeah, please.
All right. So basically, how during a panic attack, we usually, recommend some sort of progressive muscle relaxation for the individual, right? So I'm assuming that this is somewhat of a progressive nerve relaxation. So is it something that we can use when somebody is having or going through a panic episode?
Yeah. So the thing is, wouldn't call it really a nerve relaxation. It's more like energetic channels, meridian, energy meridian and energy channel work.
Mm-hmm.
But if the person, for them to be using it in a crisis situation, they should have been practicing it beforehand. Because typically in a fight, flight, or freeze response, which is our sympathetic response, we don't do things which are not for which neural pathways have not been set up in our brain. So this is, once you've practiced it enough, then it becomes like your default mode. Or once it has been told to you by a therapist or coach, then that can become a go-to practice. But yes, it can be definitely done. In fact, I recall one of my teachers telling me that they had a teacher, their colleague in Australia or New Zealand. No, it was in Bali actually. Their teacher in Bali, and her daughter was in a pub where a bomb blast happened.
Okay.
And this was, if you go back, I think there was a bomb blast in Bali at some point in time, and her daughter was there, or his daughter was there. And this child, this young adult, she had not learned. She was too young. She's like a teenager, doesn't believe in all this. But because she had seen her parent teaching this all the time, she had subconsciously absorbed it. And during the bomb blast, there were bodies thrown, body parts all over, and she started tapping. And she was one of the only people in that site who did not suffer from PTSD.
Okay.
Yeah. So everybody else had PTSD, even though she was in the middle of that bomb blast. She had seen bodies thrown all over around her. She survived. Her friends survived because they were in a different section of the pub. But because she kept tapping, her body somehow did not register it as a trauma, and she didn't have PTSD. So it's that powerful.
All right. So basically suggesting it as a habitual practice so that they can automatically, as a default response, start using it is a better option.
Yes.
All right. Thank you so much.
Dr. Nupur, would you also like to share about some resources which people can use in case they're interested to learn about this more?
Yes, absolutely. I think, if you want to know more about EFT tapping, join us for the webinar on Thursday. That will be great for the workshop. Also in that workshop, we also will suggest you some resources, but if you're not joining us for this workshop for any reason, you can still access these resources, which are very, very good, very powerful. These are some websites called the Tapping Solution by Nick and Jessica Ortner. They have created an app out of it also, and it's a very, very powerful resource. Then Gary Craig, who's the founder of EFT, who was a student of Dr. Callahan, his website called Emo Free. That's also very powerful. It's got lots of resources there. And then there is a YouTube channel by Brad Yates, and I have also trained under Brad Yates. He did one of our sessions in one of my workshops. So Brad Yates is also a very powerful teacher, and he has a lot of resources on YouTube, so you can access these.
And of course, this book, Attract Abundance Now,
yes,
which is an amazing one. So that this is one. If you like, you can take screenshot of this and you can access these later. So we still have some more questions to go, but I am conscious of the time. While we'll stay on the call, I'll formally draw the session to a close. Thank you everyone for joining us today and participating actively in the session. We really appreciate your questions. We really appreciate your joining and actively participating. We'll thank you and see you next Saturday with another exciting session. We'll be sharing the details with you shortly. Anybody who would like to join a Mindful Living community to know, to have updates of the future sessions, can type in the chat box and we will send you the invite to join the Mindful Living community. Thank you. And for those who would like to stay and have some questions, we are open. We are here.
Thank you, everybody.